So
Yes.
can we stream it live now? Can we stream it live? We are live? Right. Thank you very much. Good evening, everybody. My name is Dr. Apur Mehra. I'm an orthopedic surgeon. I welcome you all to this special session on conceptual anesthesia.
Hi, friend. This is
First
Dr.
of all, like to thank Dr. Jhanvi Bajaj for having me here. This was something she said that she will do on Teachers' Day. So happy Teachers' Day to all the legendary teachers whom I can see here and to all the students who have made us teachers. I spoke this yesterday in conceptual medicine, but I'm going to speak it here again. When we thought about conceptual, the theme, conceptual orthopedics, right? It was something which I dreamt. Something different has to be done. And when we were thinking about it, me and my dad thought about it, and Goga Bhai was seeing this evolution, right? Somewhere around 2019, right? And he used to be there at the clinic very routinely, and we used to think we will get senior teachers, all the academicians, people with experience of teaching postgraduates to teach them better, become better doctors, create a better version of you. And all my teachers used to say, there is no teaching now, MD versus DNB, right? And there is a comparison between private and government, and one entrance exam can just put you anywhere. And then you miss the good teaching in a good college throughout your life. So I wanted to break that shackle and break that barrier and wanted to create a platform where it's all equal. As Jhanvi yesterday mentioned, it's a level playing ground for everybody. Right? So the tagline for conceptual was the aim is not to live forever, aim is to create something that can. We are very happy that our teachers are very happy that we could create the legendary lectures which are archived now, and you can approach them any number of times. So you can go to conceptual, eConceptual app, go to conceptual orthopedics, open up and listen the lectures as much number of times you wish to. You have the youngest teachers in 30s, and the senior most is Dr. Tuli, Professor S.N. Tuli at 93. You have a gradation of 60 years of clinical experience. I think इतना तो हम सबका टोटल भी नहीं होगा एज का जितने 5 लोग यहाँ पर दिख रहे हैं, but that's how it is, right? And then came the second tagline, 15 teachers with more than 500 years of teaching experience. We started having people with who actually started DNB branches, who were DNB heads, and then we started with ortho. We went on to surgery, right? And then what Jhanvi did, she created one of the most beautiful content analysis. If anybody asks me which is your finest app, I can say that if you look at the content wise and structure wise, anesthesia on launch was the strongest app. How? She had completed all the recording before the launch. Unlike you, Zainab, where you started building on the launch, she had completed the recordings, built the structure up, and worked really very hard. So she deserves all the applause for that. Then Jhanvi, what happened? आपकी तारीफ के बाद एकदम से तुमसे वापस ले रहा हूँ आज जनवरी जैनब लॉन्च रेडियोलॉजी एंड हम सब ने मिलकर जो किया था उसने 3 दिन में करके दिखा दिया मुझे that's how she is, right? And then she gradually built on a different mode. So CO was built before and around COVID, recorded plus live. Anesthesia was electively made, and this was made live. But then came the second line, which I requested Harsha Bhogleji to do. She classically spoke for Sachin Tendulkar, right? For his straight drives, right? With a touch of class and a stamp of authority. And this is what I wanted Conceptual to have it. And I wrote a mail to him and that came back. This is the exact line which I repeated yesterday. It is like a revision of my conceptual lecture, right? But what added here was, we have a support of a team throughout. And that needs to be understood. Jhanvi requested, I want these lectures of Goga Bhai, Govind sir, and I requested, sir, can we have your lectures? The answer was not this, yes, answer was, why are you asking? If you ever need a teacher or any guidance, first will tell, why don't you involve this particular person? And similarly, Dr. Vivek sir is somewhere out and he cannot join the session, but he has wished you all the best, Jhanvi, for this. And for him for giving lectures on biostatistics. We are really thankful. We are really thankful to everybody who's working tirelessly behind it, and the entire team of Conceptual Anesthesia. Gaurav, in fact, is my very close friend, and he has been with Jhanvi throughout working on it. And now I will request Goga Bhai to speak something, then Sparshar, then Zainab, and then give it to Jhanvi after that. Goga Bhai.
Hello everyone. First of all, very happy Teachers' Day to all of you and all the students also, because I consider students are the best teachers. And regarding the conceptual anesthesia, I've seen right from the beginning how Dr. Jhanvi started working and how she got hold of me. कि सर ये lecture लेने हैं, ये lecture लेने हैं. And I also remember that I conducted live lectures also in conceptual anesthesia. That was a great experience. And I am very confident and proudly say that conceptual anesthesia is a very, very excellent platform for all the students who are preparing and who are doing the PG in anesthesia. So please utilize this platform, and we are always standing with you. And all the best, Dr. Janvi, and all the students also.
Thank you very much, Goga bhai, for joining at such a short notice. Sparsh.
Hi, good evening, everyone. Wishing you, as always, a very happy Teachers' Day, and just reiterating the fact that we learn every day because of the presence of wonderful people like you around. And as Apur sir rightly made a mention of the fact, the whole foundation of, I think, the conceptual app lies in the premise that he wishes to create a level playing field for everybody who's going to be pursuing a post-graduation, irrespective of their caste, creed, religion, geographical location, private, government, DNB, MD. And therefore, you would find that in a very short span of time, this is a product or this is an app which is going to be ubiquitously used by a lot of people. And I would not say it as just as an overwhelming gesture, but I've seen the kind of effort that he and his backend team puts in, of course, with the wonderful blessings of all the faculties out there, which are very ably led by Dr. Jhanvi ma'am. With her own experience, they say a very common norm in medicine is that Mumbai stays 5 years ahead of Delhi. And Delhi perhaps stays 5 years ahead of a lot of smaller towns. So you would experience why it is said so. You would get to learn a lot of things. And of course, anesthesia being a fantastic branch, it is actually something which is going to be deciding critically between the life and death of an individual. You would learn certain skill sets exclusively at Conceptual. So my best wishes to the whole team for a very wonderful initiative being taken by Apur sir and Jhanvi ma'am. Best wishes for this and best wishes to all of you for your upcoming learnings.
Thank you very much. Thank you, Sparsh. क्या बोलता है यार तू? Must. Zainab, over to you.
I'll just keep it short. I wish a happy Teachers' Day to all of you, and through Conceptual, all of the platforms, actually we get to learn a lot when we attend the classes. As you said, we have so many senior faculty, and right from in Conceptual Radiology, we have fresh pass out MD residents, who want to teach, who get a platform, to very very senior faculty. So it's a wide spectrum, and you get to learn a lot. You see them, and there are many many skills that you can absorb. So I think this is a very very big opportunity for all of the residents, where irrespective of the kind of academics that you have at your colleges, and if we know that all the residents are really short of time, so this gives you that access and the platform that you can utilize, and don't have that undue pressure of learning every day, reading every day. So this makes it very very accessible for the residents. So do take out time on a day-to-day basis and make sure you're doing something every day. That should be the initiative, that these platforms will have. So you learn something every day. That should be the target, and it never stops. We are still learning till this date. So the learning never ends, and just utilize this. You have fantastic teachers, who are there, and that's it. Happy Teachers' Day, and over to you, Jhanvi ma'am.
Jhanvi, all the best for this session. Do answer one question which students have asked.
Yes.
We have to choose between MD or DNB versus diploma anesthesia. What should we do? Just cover that, and all the very best. Thank you,
Yes,
Dr.
sir.
Zainab. Thank you, Sparsh bhai. Thank you very much.
Very
Bye.
much.
Bye.
Thank you to all the teachers for coming here today, and happy Teachers' Day to all of you. I would first like to thank Apur sir, because he has placed his faith in me while creating the conceptual anesthesia platform. And it was not an easy task. It was actually, anesthesia is one of the biggest subjects that is out there when you start off your residency. So you're looking at upping your skills in 3 years, as well as preparing for one big subject in the next 3 years. And that is why we have it here in conceptual anesthesia, everything for you all to make sure that your journey goes smooth. But before talking about the app, let's discuss, is anesthesia the career that you want to follow? Now, over a period of the next 20-25 minutes, I am going to discuss everything with you all regarding what are the seats that you have to take, how do you choose which college to take, what are the pros, what are the cons, what is your day in the life of an anesthesia resident, what is the day in the life of an anesthesia consultant, how do you see yourself 10-15 years down the line. So we are going to absolutely cover everything about anesthesia over here. So first of all, let's start off with the possible academic options in India in anesthesia. So as sir said that we have to discuss about MD, DNB, DA. This was my first slide itself. When you start out, you have three options to take. First is MD, and this MD is going to be available in government colleges all over India. Second is going to be DNB, which is going to be in private hospitals all over India, as well as some of the semi-private institutes. And third is DA, which is Diploma in Anesthesia. Now, what is the difference between the three of them? MD in government hospitals will have a bond attached to it. So you will have 3 years of study plus 1 year of bond. DNB will be in private hospitals where you will not have a bond. And both MD and DNB are 3-year courses. But when we speak about diploma anesthesia is a 2-year course. And this is something which generally people follow it up with a secondary DNB. So once you get into diploma anesthesia, you complete the 2-year course. Then in some states, you have a bond that is associated with diploma. So you may or may not complete the bond at that point. And then you give a secondary DNB entrance exam. Now, this secondary DNB entrance exam has mostly questions based on anesthesia as well as little bit of questions regarding the rest 18 subjects also. So essentially, this is another small mini entrance exam, which will help you on the basis of your rank to decide which secondary DNB college you want to get into. Okay. Now, secondary DNB again becomes 2 more years. So if you see the whole course of DA plus secondary DNB, it goes up to 4 years plus your bond of DA. So definitely, having said that, DA DNB is a longer course as compared to MD or DNB. But again, it depends what is your choice, what is your rank, and what are you getting at this point in time. Let's discuss each of these courses a little bit and why I feel, according to me, that DNB is as good as MD. So in MD anesthesia, when you're getting in, first thing that all of you should see is the college that you are going to apply for as your first choice. Does it have all the super specialties? Now, when we talk about super specialties, I mean that does it have neurosurgery, cardiac surgery, pediatric surgery, oncosurgery, obstetrics? Because when you start your anesthesia residency, you're going to rotate in each and every of these OTs. So you will have 1 month rotation in all these OTs, and you will learn how to give the specific kind of anesthesia for each of these super specialties. Now, why is it important to learn all of these super specialties? Is because this 3 years will give you an overview of all different kind of cases that you can encounter later on in your career. So it's not like you will be giving anesthesia only for cesarean sections all day, all your life. No, you may have a day in which you will have to give anesthesia for bronchoscopy, followed by plastic surgery, followed by cesarean section, followed by something in interventional radiology, because anesthesia is required for almost every procedure that is done now. Even like small procedures like MRI and CT scan, especially when you see kids, you need GA or sedation for them. So as a result of this, you need to be exposed to maximum number of cases, and you need to know how to handle these different types of cases. So when you choose a good MD institute, and the ones which have, especially which have a lot of super specialty and a very high case load, then you know that at the end of 3 years, you have that confidence that you have managed many different kinds of cases. Now, talking about DNB. So DNB for 3 years in the major hospitals, like suppose we talk about Apollo, Medanta, or in Bombay, you have Leelavati, Hinduja, or Breach Candy, all of these major hospitals at max super specialty hospitals. So all of these are the ones which are multi-speciality. Whenever you're going to take DNB, your first choice should be for a multi-speciality hospital. Again, it should be for the same reason. Why? Because you are exposed to more and more super specialties over there, and you have an idea of different types of cases and what will be the type of anesthesia required for them. Another thing that you will see in multi-speciality hospitals is that they have very good ICU. Now, critical care falls under both anesthesia as well as medicine. So there are lots of hospitals where intensivists are actually anesthesiologists. So anesthesia residents also get to rotate in these hospitals in the ICU to see if they want to cover critical care later on in their life as a career option. Okay. So when you are going to take your DNB, remember to choose a multi-speciality hospital which has a high caseload. Now, a lot of people say that, ma'am, in DNB, I will not get any cutting. People will not give me anything to do on the private patients. Now, that is not true in case of anesthesia. In case of anesthesia, most multi-speciality DNB institutes have a department, and in the department, there are different consultants. And these consultants will all help you grow in terms of your knowledge as well as your skill. Now, what are the skills that you need in anesthesia? First, you should know how to intubate. Second, you should know how to give spinal, how to give epidural, how to put central line, how to put arterial line, how to give peripheral nerve blocks. So these are all the things that you do day in and day out while giving anesthesia. And it's not like from day one itself, someone will start giving you laryngoscopy and blocks. No, it is built over such a way that first year gets the most basic cutting like laryngoscopy and spinal. Second year will start getting epidurals, and third year will get blocks. So even in DNB hospitals, the consultants, yes, they do give you all of these skills to do as well as to master. Now, if you feel at the end of 3 years that no, I haven't gotten enough cutting, I did not have enough case load, or rather what I feel is the major thing is when you work in MD institutes, in many places during emergencies, during calls, you have only one lecturer who will be supervising what you're doing. So more or less what you do is something that you learn on your own and you develop your own confidence because there aren't too many people supervising what you're doing. Versus in DNB hospitals, every minute that you are in the OT, you will be supervised by a consultant because these are private places. So, and sometimes they may say that, okay, let me go ahead and do this procedure and you can watch. So if you feel little underconfident at the end of 3 years of DNB, then again, you have SR-ship to cover. So you can take SR-ship in a very heavy government hospital where you will be doing everything without any consultant at your head. You will be taking your decisions, you will be doing your procedures. So all of these things can be covered up during SR-ship also. Having said that, I will reiterate the fact that most of the DNB hospitals now do give a lot of procedures, and including I have worked at DNB hospitals, I have seen that the students over there have developed a lot of skills. Then coming to the last option, that is diploma anesthesia. Now in diploma anesthesia for the first 2 years, mainly you will end up going to some of the government institutes to do your diploma. In those 2 years, you will develop a lot of skills, and at the end of 2 years, you will also give an exam. So you have already built your knowledge on the basis of 2 years to give the DA final exam. So in 2 years, you do build your skills by working in government hospitals. Then after that, in secondary DNB, you get to build more on your knowledge as well as your skills. So when you go for secondary DNB, you already know half of anesthesia. You're just going to polish yourself and to increase the efficiency of your degree by saying that after diploma, I completed another 2 years of DNB so that you stand at the same level as a MD DNB. So these are the possible academic options in India. Regarding the bond varies anywhere between 1 year to 3 years post your MD. After DNB, there is no bond. And after DA, most of the institutes have a 1 year bond of DA. So next thing is, what are the work and responsibilities as an anesthesia resident? So as an anesthesia resident, you may feel that you're going to be only in the OT, only for the cases. No, that's not correct. Actually, you have to be in the OT for different cases. You have to be in radiological suites like CT scan, MRI. Then you have to be in places where they give interventional radiology for procedures. Then you also have postings in the ICU in critical care. So you'll have like 1 month of continuous critical care posting where you will shadow an intensivist. Then you can also attend pain clinics acute pain as well as chronic pain. Most of these are very high load places, especially in cancer hospitals, because in cancer hospitals, you have a lot of people of chronic pain, cancer pain. So there you get to see a lot of OPD based practice regarding pain as well as interventional pain procedures. Now, interventional pain is really upcoming and it is something which is very interesting. So you give blocks. So basically, you are destroying the nerves that supply the painful stimulus to any organ of the body where you have cancer. So basically, you do things like celiac plexus block, or for trigeminal neuralgia, if you want to give a block, or for stellate ganglion block, if someone has CRPS of the arm, or even the most simplest and the thing that people keep coming for again and again is basically blocks in the spinal nerves. And this is for persistent back pain. So people who don't want to undergo spine surgery, they come for these kind of blocks. So these are called as facet joint blocks or transforaminal blocks. So all of these are procedures that are done under C-arm, procedures that are done under ultrasound guidance. So you're visualizing the structure with the C-arm or ultrasound guidance and then putting in a needle, and then you're giving the drugs to relieve the pain. So this is something which is very similar to interventional radiology, but anesthetists also do it because we use drugs that take care of the pain. So this is interventional pain, which is upcoming. And the last thing where you will rotate is also in the OPDs. Now, in the OPD, you will have a 1-month posting of pre-anesthesia checkup or pre-anesthesia clinic, where you will be giving fitness to patients for anesthesia. So as an anesthetist, you will be rotating in all of these places and not just the OT. All right. Now, what is the typical day in the life of an anesthesiology resident? So when you're doing your residency, your days are going to be heavy, and you should be thankful that your days are heavy. Trust me, you take up any branch, you should be extremely happy if you have a heavy day. Why? Because the more you learn in your residency, the better you will be able to perform in your career later. So always go for somewhere where there is high volume workload. Now, high volume workload does not translate to toxicity. Remember, everyone is working too hard, everyone is frustrated. So when you join residency, it's a big shift from your life of being a student to your life of being a professional. So some things will change, like when we were students, we used to randomly take chutti some days and sit at home. Okay, but you can't do that when you become a professional, when you become a resident. You have to be there and you have to work day in and day out. Even when you're sick, there are days that, like unless you're extremely sick, you're not able to take a holiday. So you will be starting your day at around, as an anesthetist, we are always in the OT before the surgeon. So we start our day around 7:30 in the morning. We go, we check the OT for all our equipment. We check the anesthesia machine. We prepare the drugs. Once all our OT preparation is done, then the patient is brought into the OT. Once the patient is brought, you will talk to the patient, check the consent of the surgery and anesthesia, and then we start the whole procedure of anesthesia. Now, the whole procedure of anesthesia, depending on how complex the cases, lasts for about, say, like 15 minutes to even 1 hour, depending on if you need to put invasive lines in the patient. Once anesthesia is induced and once the patient is settled, once the patient is under anesthesia and the surgery has been started, then this is the best part about anesthesia, which does not happen in any other branch, that you will be sent for eating your breakfast or having tea. And anesthesia that way is a wonderful branch because you will be given breaks at every point in time. So you will be given your breakfast break at the right time, you will be sent for lunch at the right time, and you will be sent for your evening tea with snacks for at the right time. And if you're on call, you will even relieve for dinner at the right time. Okay, so while you're in residency of anesthesia, I can tell you for sure that you are never, ever going to go hungry, barring 1 or 2 times when you're actually in an emergency case and you can't leave and go. How do we do that? Because anesthesia everywhere is a big department. I have worked in department of about 100 people, 100 anesthetists also, and there are department as small as 5 people also, depending on how heavy the hospital is. So when you have a department of about 100 people, there are always people to come and relieve you in their place. Okay, so for example, if you're the first year, your third year will come and relieve you and say, chalo jao, go and have tea and come, go and have lunch and come. So there is always someone inside the OT during the case, but we all work and we all support each other in such a way that everyone's meals are always done on time. If you want bathroom break, you can call someone to relieve you. So that way, anesthesia is a very comfortable branch. Second thing is that once you induce the patient, then it is not necessary that you have to keep standing all the time. You're not going to spend all your energy unless it's a very high risk case and things are dynamically changing. We generally sit and we monitor the patient throughout the procedure. So suppose it's a 2-3 hour case and the patient is stable, you can sit and you can watch the monitor and you can complete writing your papers. So this is a good branch for people who don't like to be tut on the go all the time. The people who don't like to be spending all their energy running around the whole day. Having said that, it requires a lot of mindfulness in anesthesia. So the mental energy that you're using is a lot. So at the end of the day, even though physically you have not run around so much, you may feel mentally a little bit tired, but you will never be like overly fatigued at the end of the day. Then the next thing is that, so your day goes on and depending on the list, you have a lot of cases. Typically, a normal day in anesthesiology residency will finish by, say, about 5 o'clock. So that will be 5 to 6 o'clock is when the elective cases will finish. And then the emergency cases start. Now, if it is your emergency day, then your emergency will continue in the night and then the next day also. In most of the hospitals, you have to do a 36-hour duty. Now, in the 36-hour duty, you may think, oh my God, ma'am, at night I will not get to sleep. No, again, it is not like that. When there aren't any emergency cases, you can go and sleep. Or suppose there are less emergency cases, the residents divide amongst themselves that who will be attending which case. So you get at least 3 to 4 hours of sleep in the night. And usually, since I told you the departments are so understanding, the next day they will be relieving the people who were on emergency duty the previous night. So our consultants in most of the anesthesia and departments are very, very understanding and very approachable. So that is how you work on emergency days. And on non-emergency days, you finish by 5, 6 o'clock in the evening and then you're done. Now you don't have to come back to the hospital as an anesthesiology resident. In some places, they may ask you to come back to do some PACs, but most of the places, once you finish your work at 5, 6 o'clock, then you don't have to wait till night to take rounds like in other branches. So you're done at 5, 6. Okay. And that is your typical day for the next 3 years. Now, this is how you will be working in and day out for 3 years. After that, once you give your final exam of MD or DNB anesthesia, then you have to choose that what do you want to do post-residency. So in post-residency, first option that a lot of people consider, especially people who have economic burden, people who want to get out there and start earning for their parents, for their families, they will start freelancing. Now, for freelancing, you don't need any investment. Like in many branches like ENT, opthal, surgery, you need some kind of investment at least in your clinic rent, or where are you going to sit, or where are you going to consult patients, or the instruments. So all that kind of investment is required in marketing. But in anesthesia, none of this is required. In anesthesia, you just have to spend 250 rupees to make about 100 cards. You can make it online, 100 visiting cards. And you can go and give it to the surgeons that you know, and also surgeons and nursing homes that are around your area that you don't know. Now, the initial investment that you will make is probably just one nice bag where you can put some anesthesia equipment like this auntie is showing. Like you need your own set of laryngoscopes and endotracheal tubes, airways, the basic stuff. And the whole investment will be less than 10,000 rupees. And you will start doing your cases from the first day itself. Now, a lot of people are not confident to do cases as soon as they come out of their residency. They feel like we want to study more or we want to practice more. So in this kind of scenario, people work together. Like 2 or 3 anesthesiologists can form a group and they can go and give anesthesia together so that everyone builds each other's confidence. But if your 3 years of residency was full of cases, you have managed many cases on your own and you're super confident that you will be able to do well, then you can start off as a lone anesthesiologist also. So this is your first career option. If you want to immediately start working post your MD DNB, you can start working as a freelancing anesthetist. Again, I wanted to add one more thing over here, that for people who have done DA, many a times people who have done DA don't immediately want to get into another secondary DNB course. They want to wait for some time. They want to make some money. So in that case, I have seen people who after DA, 2 years of DA, also get into freelancing. And they have the degree for it. So it's absolutely valid. Next, some people after they are post 3 years of residency would want to go for super specialty. Now, super specialty is something which is coming up in most of the cities. You actually have super specialty hospitals. So you have cardiac hospital, you have neuro hospital, you have onco hospital. So they prefer to hire people who belong to their specialty. Like a cancer care center would try to employ onco anesthetists only. Cardiac surgeon, they usually form a team. So they will have their own perfusionist. They will have a cardiac anesthetist. So they will look for only cardiac anesthetist. They will not want to go with a general anesthetist. So if you are planning to do any super specialty, these are your options after 3 years of residency. First is DM or DNB. So DM is again available in most of the government institutes all over India. And DNB is SSDNB, super specialty DNB. For both of these, there are entrance exams that are present after residency. So what people do is after residency, they do their 1-year bond. During their bond, they prepare for the super specialty entrance. And then depending on their rank, they take up the next DM or DNB for 3 years. Now we have DM or DNB in all of these branches: critical care, onco anesthesia, pain, neuro, pediatric, and cardiac anesthesia. And this is again another residency which may or may not be followed by a bond. If you don't want to commit to 3 years of doing a super specialty residency, it's absolutely okay to do a fellowship in any of these branches for 1 to 2 years. So fellowships are also available in critical care, onco anesthesia, pain, regional anesthesia, airway fellowships all over India. So this is your other option if you don't want to do super specialty after anesthesia. And mind you, when you go in for a job as a person who has done DNB or DM for 3 years versus someone who has done a fellowship for 1 to 2 years, there is not much of a difference. Yes, the person who has done 3 years super specialty will be given more preference as compared to fellowship. But if the fellowship person happens to have more experience as compared to the DNB who is just fresh pass out, then he may be considered for the job more as compared to the person who has done DM or DNB. So whenever you're going in for a job, it is not just your degrees that they will be seeing. They will also be seeing your years of experience, your letters of recommendation. And at the end of the day, they will see who is the best fit for their hospital at the salary that they are offering. So, and whenever corporate hospitals will employ someone, they want someone who will stay in for the long haul. So someone who commits to staying in the same place just for 6 months to 1 year, versus someone who commits that, yes, I'm going to spend my entire life over here, is probably the person who commits to entire life at the hospital will be taken in. So that is a trick whenever you go in for a job interview. Even if you don't plan to stay for more than 1 to 2 years, say, "Arey, main to puri zindagi idhar hi rehne wala hu." So that is about what you can do post residency. So you have option to immediately start working, that is freelancing, or you have option to study further by doing either a 3-year DMDNB or a 1 to 2 year fellowship. Now let's talk about the most important part that everyone wants to know in anesthesia: what is the income? So when we talk about income, I have made this table for you all. If you all want, you all can take a screenshot. These are the approximate per month incomes. Now, I have not written how much you will earn in freelancing, because in freelancing, the sky is the limit. Freelancing is totally effort dependent. The more number of cases you do in a day, the more you will earn. You're going to get paid per case over there. So depending on how many cases you do, you can earn anywhere between 3 to 5 lakh, 6 lakh, 10 lakh. Like I have seen people earning a lot per month if they are working from morning 6 a.m. to night 12 a.m. But if you want to have a work-life balance, you want to work only from 10 to 4 also, then you can easily earn anywhere between 2 to 3 lakh rupees in freelancing. Now, again, when you see the opportunities are equally distributed in cities as well as in periphery. So wherever you're planning to settle, it does not matter much, because anesthesia is something that is wanted everywhere. When you come to government versus corporate salaries, so if you join a government institute post your residency, this is all approximate that I'm giving you. So post residency, immediately after 3 years of residency in government institutes, you can earn anywhere between 80,000 to 1 lakh rupees. And in a corporate institute, they can start you anywhere between 1 to 1.2 lakh rupees per month. Then post 5 years experience in government, you may get a job for about 1.5 lakh per month. In corporate, you'll get a job which ranges around 1.5 to 2.2 lakh. And if you're good at negotiating, this may even go up to 2.5 lakh. After 10 years of experience in a government institute, again, government institutes pay slightly lesser as compared to corporates. But the good thing is that in government institutes, your work is limited, and also the most important thing is that you get a lot of these leaves. So you have government pension that you will get at the end of the day, you get health facilities by the government, and you get leaves like summer vacation, winter vacation, and public holidays, and some maternity leave, and all of those things are available in government. In corporate, you don't get these kind of leaves, and definitely the working hours in corporate are much higher as compared to in government hospitals. So post 10 years experience in government hospital, you can be earning anywhere between 2 to 2.5 lakh rupees, and in corporate about 3 to 5 lakh rupees. And post 25 years experience, that is, like if you start like at the age of 30, then at the age of 55, 60, in government, when you become like head of department or professor, you can earn anywhere between 3.5 to 4.5 lakh per month. And in corporate, you can earn anywhere between 8 to 15 lakh rupees per month. So this is something that I have got over a period of time, spending my time in every kind of department. So I have worked post anesthesia, post my residency in a government hospital, that is a municipal corporation hospital. I have worked in a central government hospital like Tata. I have also worked in a DNB hospital, and now I'm freelancing. So as a result of this is from all the knowledge that I have gained over the years. Now, post-residency, suppose you don't want to stay in India, suppose you want to move abroad. This happens a lot of times that people meet their soulmate in anesthesia, and during their residency, they fall in love and they decide that let's build our home somewhere abroad. So which are your options? So you can go to the UK. UK is one of the easiest options for anesthetists to get into, because in the UK system, they have a big deficiency of anesthesiologists. So it requires you to build up your CV, to get some letters of recommendation, to give some basic English exams like IELTS, and then you can apply for becoming an anesthetist in UK. Once you go to UK, you have to start giving your FRCA exams along with some experience. So that is 2 years, and then you enter into training, which is another 5 to 7 years. So to become a consultant in the UK, once you finish your residency in India, it's going to take another 10 years at least. But life over there is comfortable. There is a great work-life balance. They have almost, I think, just 4 or 4.5 working days in a week. And the pay is quite good. And of course, you're very close to the European countries. So for people who like to travel, going to UK and living over there is really nice. Then the next option is UAE. So UAE, what most of the people do is like people go to UK, finish their FRCA, that is Fellowship of Royal College of Anesthesiologists exam. And then after finishing FRCA, they take a job in UAE. UAE countries give more money to people who come via UK as compared to directly from India. But if from India you want to go directly as an anesthesiologist to UAE, then you have to give the Dubai Health Authority examinations, and you can get a post over there. Another option, especially for people who do critical care, is to go to Australia. So Australia also has a dearth of intensivists. So Australia, again, good work-life balance, good pay. So that is another path that you can choose. The most difficult out of all of these is to get into the US. In US, anesthesiology is one of their top branches, and thus it's not easy to get into US in anesthesiology. So if you want to go to the US, you have to start giving all your USMLE steps. And along with USMLE steps, you need to work over there in some hospital and give your do your electives, get your letters of recommendation, and then apply for the match. Now, when you apply for the match, you may match into anesthesiology residency, but you may not match into anesthesiology residency also, in which case you may have to take up medicine or pediatrics and completely change your branch. So depending on how good is your CV and your luck and your scores in the USMLE steps, you may or may not get anesthesiology over there because it's a very coveted branch. What are the pros of anesthesia as a branch? So the pros of anesthesia as a branch is time. When you start working, timings are completely defined by you. If you want to work in a corporate hospital or a government hospital with fixed timings, typically anywhere between 8 to 5, 8 to 6, then you can join over there. Suppose you don't want to, you're okay with spending much more time because you want to make more money. You can do freelancing and the time is totally dependent on you. Suppose you have just delivered a child and you have no one to take care of the child at home. So you can get out of your house only for a couple of hours to work. Again, you can freelance, you can go just for one case and come back. Just spend 2 hours a day at work and come back. So depending on different stages of your life, time is something that can be molded easily in anesthesia. It is totally dependent on you. And money, again, I told you in government as well as in corporate, you have a structure of money which is fixed, versus when you go for freelancing, money is totally effort dependent. So if you feel like you want to get worth your money, worth your time, you want to be paid, then you can go in for freelancing. Third thing is, you don't have to market yourself at all. Once you start working, even if you go for a single case with a surgeon and he prefers you and he likes your way of working, the only thing that he will want from you is your availability. So every time the surgeon calls and you are available for a case, you should say yes. The only marketing that you need is to show how skilled or talented you are and how well you can work with the surgeon. So you don't need to go and do any social media marketing or put any posters of your hospital or your nursing home. So in anesthesia, absolutely zero marketing is required. The surgeons in your area only need to know that you're working and they will call you. Next pro is that there is no saturation in this branch. Now, when I say no saturation, even if you're working in a big city, there are lots of hospitals, there are lots of nursing homes, and there are lots of standalone centers which need anesthesiologists, and the cases keep on going the entire day. Then you have emergency cases in the evening, and it's not like one anesthetist can be the whole and soul for one hospital. No, one hospital will typically have about 3 to 5, 10 OTs. So for each OT, they will require one anesthetist. So there is a lot of need for anesthetists now, not just in the OT, as I told you, in IR, MRI, CT, all of these places also we need anesthetists. So you will never have dearth of any work, and everyone has enough work to do. When you talk about working in the periphery also, in fact, there are lesser anesthesiologists in periphery. So if you start your own practice in periphery, I have heard that people make a bigger lifestyle and more money in periphery because they are able to get so many cases. They are like the most wanted people over there. Like a small town will have just 5 or 6 anesthesiologists and they will have a lot of work. So there is no saturation in this branch, and saturation is only in your head. If you're a good person, if you're good at your work and you're sincere and you're available, then you will have enough work to even start saying, no, I cannot make it. Next is AI can never take over this branch. So there are certain things that we do like intubation, giving spinal, epidural, all of these require human touch. You would not want a robot to be doing this. So AI can help a little bit. There are robotics and anesthesia in drug infusions and stuff, but AI will never take over an anesthesiologist. Also, when you are under anesthesia, when you're in that life and death situation, you will not want someone to actually be monitoring you who is not human. So AI can never take over anesthesia. Another thing, anesthesia as an end branch. So anesthesia can be considered as an end branch if you want to finish your studies at the end of 3 years of residency. But if it is absolutely your own choice, if you want to go in for super specialty, so you can finish anesthesia at 3 years, or if you want to do super specialty, you can study more. Last is work-life balance. So again, work-life balance in anesthesia is something that is totally decided by you. If you want to be an anesthetist who wants to work extremely hard, who wants to run everywhere, then you're going to be just a, work hard, don't play person. But on the other hand, if you want a work-life balance, you go in for a corporate or a government job where you will be working fixed timings. And in the evenings, you're going to be absolutely free. Typically, once we get out of the OT and we ship the last patient to the recovery room or the ICU, the patient is under the care of the intensivist, and then we will not be called back to the hospital for anything. So you have your evenings free to spend with your family. So these are the pros of anesthesia. Then let's look at some of the cons of anesthesia. So a lot of people say that the branch is very surgeon dependent and you're absolutely dependent on the surgeon to call you for the cases. So let me tell you that either your branch can be surgeon dependent or patient dependent. Patient dependent means you have to get patients, you have to do marketing, you have to go and let people know that you have your own clinic or nursing home after so much investment, and also it's not something that is very consistent. Versus if you have to go and form a team with a surgeon and you have to let him know that please do call me for all your cases. That is much more easier as compared to your branch being patient dependent. Nowadays there is a lot of competition out there in the market among surgeons, orthopedics. So it is better that your branch is surgeon dependent, in which you can work with like-minded people, as compared to your branch being patient dependent. Second is there is no patient contact. So typically when the patient comes in the OT, we speak to him a couple of sentences and then we put him under anesthesia. And once the case is over, we shift him to the recovery room after waking him up. Maybe you'll speak a couple of sentences over there. So there is no patient interaction as such, is what people think about anesthesia, but that's not true. You're seeing your patient prior to the surgery while you're doing pre-anesthesia evaluation. If you're a good anesthetist, post-surgery, once the patient is shifted to the room, you can go, you can talk to the patient. And these are your points of patient contact. Also, patients have a lot of questions in their head. They Google a lot nowadays. They chat GPT a lot nowadays. So as a result of this, lesser the patient contact, better your life becomes. So that is another point. And the third thing is anesthesia an emergency branch? Again, as I told you, if you're willing to do emergencies, then you can say that, yes, I will be available for emergencies. But suppose you are a new mother, or suppose you have some home commitments and you're not able to do emergency cases, or you can't work after 4 or 5 o'clock in the evening, then you can let the surgeon know in advance that I will not be available for emergency cases, but this is my colleague who can do the emergency calls. As long as you provide a replacement, everything works very smoothly. Having said that, if you are going to work in a corporate hospital or in a government hospital, then once a week call or less than that is mandatory. So that is something that you will commit to knowingly, and you will know which are your emergency days so that you can keep your personal affairs in order on those days. So these are the list of the best MD anesthesia institutes in India. If anyone wants, you all can take a snapshot of this, and when you're actually putting in your branch options, you can put it. These are your best DNB anesthesia institutes in the north. Then next we have the best, this is again best DNB institutes in north. Then we have best DNB anesthesia institutes in South India. And these are your best DNB anesthesia institutes in West India. So these are some of the institutes that I have put up. Now, a lot of you messaged me asking that, ma'am, please, can you tell me which hospital should I take? Which institute should I put, this one over that one? Now, of course, we also don't have information about each and every hospital and how each and every department is. So if you're going to choose the hospital where you want to do your MD or DNB or DA, my advice to you is this. First of all, if you want to stay closer to home, then start looking in your same city or somewhere close to your city. It's very comfortable to be somewhere close to your house during your residency, because there are days which are very heavy, days where you fall sick. So you want to be close to home in those cases. If you're okay being all over India, then you can go for institutes as per their ranking. Second thing that you should look for in any institute, in any MD or DNB institute, is that it should have the maximum number of specialties. So it should be a multi-speciality institute, just because, how I told you in the beginning, you need to be exposed to the maximum number of cases during your 3 years of residency, so that you're a confident anesthetist at the end of 3 years that, yes, I have managed all of this. So look for a multi-speciality institute. The third thing that you should be doing is you should be going and doing a stint of 7 days in any institute. Okay, it could be your own hospital where you have done your MBBS from. So go and work with the anesthesia department for 7 days, rotate over there for a few days in different OTs, and see, do you like anesthesia? Some people find it boring, especially the part where you have to sit and monitor the patient the whole day. But once the case is your responsibility, that boredom goes away. The boredom is there in the initial few months, because at that time you're just doing what you've been told. But once you start using your own brains and you have to do your case as your entire responsibility, that is the time when the real fun of anesthesia kicks in. So go in and try to work for 7 days in under someone in anesthesia and see if this is something that you should be doing for the rest of your life. Now, whichever institute you guys feel like applying for, please speak to the residents of that institute. Try to get some or the other contact via Telegram or via Facebook and directly speak to the resident in that institute. I have either first, second, or third year resident. They will give you the most truthful idea about how the department is, how does the work happen, how difficult or easy the emergency are, and whether you should be joining the institute or not. So the best person to tell you whether to join this institute or that institute is not me. It is not some other teacher, but it is someone who is belonging to the department, who is working there day in and day out. So if you are confused between two hospitals, then please go ahead and contact some resident who is working in the anesthesia department over there and try to get information. The last thing, as we started and now we've discussed everything possible about anesthesia as a career option, is if you end up taking anesthesia, then remember your days are going to be heavy, especially during your residency. You're not going to get much time to study. So we have made this app for you all, the Conceptual Anesthesia app on the eConceptual official platform. This app has over 500 plus recorded lectures, and all these lectures are basically divided into, if you look over here on this part, we have divided it into as per you need to study for your first, second, and third year. So in your first year, you need to study the basics of anatomy, physiology related to anesthesia, pharmacology related to anesthesia that has been taken by Govind Rai Garg sir, pre-anesthesia evaluation and tests, monitoring, equipment, then the anesthesia machine. Then as you go into second year, we have one whole section which has about 300 plus lectures on anesthesia for various subspecialties. So all the experts all over India in pediatric, neuro, obstetric, cardiac anesthesia have taken lectures for different super specialties and the anesthesia related to it. And then finally for your third year, we even have the DNB papers, which the last 5 years DNB papers that have been solved, and we have converted this into books also. We have books on pharmacology, drugs used in anesthesia, instruments, cases in anesthesia, used for anesthesia practicals. And then we also have demonstrative videos, as you can see down over here, like in the OT, we have short videos of how to perform fiber optic bronchoscopy, how to check anesthesia machine, how to give blocks. So everything that you require for your anesthesia preparation from day one itself is something that will help you, the Conceptual Anesthesia app. And this app, the best part about this app is not that we have just recorded and put everything on the app. Since the conception of this app, we have a live lecture taken by one of the best faculties in India every single day. So in the Conceptual Anesthesia app, every single day we are having a live lecture on different topics. So that live lecture helps you to get stimulated that, okay, even if I have come back after a very heavy day, let me just listen to something that is going on, something that the teacher is teaching. So you have the option of either watching something which is recorded, something that you know, like if you're posted in cardiac, then you can watch a cardiac lecture, or you can watch one of the live lectures that is going on. So these are all the things about the Conceptual Anesthesia app, which is going to be super duper useful to you all if you all join anesthesia residency. So I hope that this entire presentation actually helped you understand most of the aspects about anesthesia. And yeah, I think I have covered most of the questions that most of you messaged me on Instagram also. So if anyone has any more questions, you can always send me a message on my Instagram ID, the real dog Jhanvi Bajaj, and I will be happy to take your questions over there regarding anesthesia. And that's it. Thank you so much for joining me today.